We're going to turn from sleep deprivation and rest in the workplace to really talking about another disruptor in this space, private and public exchanges. And joining us to lead this discussion today is Rosemarie Day, president of Day Health Strategies. And Rosemarie and her team bring a very interesting perspective, not only a long arm of public experience, but also private experience. And she's actually been a speaker at our event. And nice to have you back, Rosemarie.
Great, thanks. Happy to be here.
Give our audience a little bit more of a backgrounder on Day Health Strategies, if you would.
Happy to do that. So we are a consulting firm based in Massachusetts that, as you said, is grounded in both knowledge of private and public health insurance exchanges. And my own personal background was helping to launch Rosemarie Care in Massachusetts, and we set up the nation's first state-based health insurance exchange. And so we did that starting 10 years ago in 2006. Built that. It became the model for Obamacare. And after that was launched, I left the Health Connector to start my firm to help, continue the revolution, if you will, of creating health insurance exchanges. So my firm helps both the public and private sector to navigate that terrain, and particularly right now, moving into helping employers figure out if a private exchange is the right solution for them.
When we look at the employer perspective now, I think a lot of us look back and see that last year, we had a 35% increase in private exchange adoption across employers. And that's good when you compare it to things like parallel growth of HSAs, but I think it was a little bit slower than people had anticipated. But let's look ahead to this year and next year and the year after. What are you hearing from your employers, and what do you see evolving?
Well, I think there's continued interest in private exchanges. I think we're seeing the rapid rate of growth that some of the consultancies had projected, but we are still seeing a pretty healthy rate of growth. And I do think that that employers who have tried to find other ways to save some money in their space, and if they feel like they've exhausted those possibilities, they're the ones who are more likely to turn to looking at a private exchange as, a new solution.
Yeah. So what do you talk about the benefits to the employer and then to their employees too of adopting an exchange?
Absolutely. So there's basically three potential benefits, and I want to stress that it does depend on where an employer starts. Some employers have tried a lot of things already, so some potential savings they may have realized without even implementing an exchange, and others really can be more at square one and haven't got the benefits of looking at new plan designs and giving their employees some choice around that. But in terms of what employers can find in terms of private exchange benefits, there can be savings to actual healthcare costs. That's the first one. The second is that they give their employees more choices, and we know that consumers like choice as long as it's not an overwhelming amount of choice. And then the third one is that there can be some administrative savings as well from having a different benefits administration platform.
Ron?
Yeah, Rosemarie, it's Ron Bachman here. Can you talk to our audience who otherwise probably very confused by exchanges? There's different types of exchanges, different ownerships. They're started up by different segments of the healthcare business, from technology companies to consulting firms to insurance carriers. Can you talk a little bit about the different types of exchanges and kind of help our audience understand the value that they ought to be looking at and the impact of the ownership or who started it versus what their choice might be on where they should go with exchanges?
Absolutely. I think we see them falling into three main categories, and there are the single carrier exchanges where a health insurer is offering only its own branded products on the exchange. So there might be a wide variety of choice, but it's just through one health insurance company. And a number of carriers have launched those types of single source exchanges. We also see a number of the brokers or benefits consultants establishing exchanges, and they come in a lot of different shapes and sizes, but generally that might be Aon Hewitt, Mercer Marketplace, Willis. companies like that have established exchanges, and those can be multi-carrier, or they can be single carrier. Depends on what philosophy that particular broker or consultancy brings to it. But they also have set up relatively sophisticated technology platforms as the single carrier exchange have. And then there's the companies that came at it because they were actually more like an IT company or in the benefits administration space, and they're moving, kind of horizontally, if you will, over to pick up the health insurance aspect and create a private exchange. And you see companies doing that where they don't bring, a predisposition towards one insurer or another, and they might, again, do single or multi-carrier, and they're moving into the space from that more technology platform direction.
So how does an employer listening to this try to figure out what direction they should go? Is there a general profile of a large employer, a small employer, a self-insured, a fully insured, a certain industry? What is it that an employer should say, okay, I have these three options before I start looking at the multiple organizations that within these three areas? How do they know which one to even start with, or is there a likelihood, or is there no particular pattern that's developing?
Well, some of the benefits consultancy-based exchanges have started with very large employers, and so 5,000 lives and above, and so that kind of limited the marketplace from that standpoint. So that wouldn't be an option for a smaller employer, though we're seeing them starting to move. So Aon is an example. They're starting to move to more mid-sized employer. Some of the technology platform ones were really set up like you could be any size of employer at all, and it didn't matter. They'll scale to whatever because they were more about the tech platform than exactly what the array of benefits are and whether you're fully insured or self-insured. So it has really been a little bit like the Wild West, and so typically an employer is going to need the help of either their broker or benefits consultant to help them navigate it, because there are over 180 private exchange options. Again, some can be eliminated if you're not the right size, or if they only take fully insured and you want to stay self-insured, that type of thing. But you kind of need, we recommend there being an independent navigator, if you will, to help sort those options out, because, you may not be shown the full array if you're only talking to a broker or benefits consultant who might have an interest in the particular exchange they're selling.
Yeah. So I understand your organization does some consulting, other than exchanges. Are there any particular lessons from your general consulting work with large employers or mid-sized employers that are helpful as they move into an exchange? So here's some things you ought to be looking for that weren't available before, or are more likely to be done efficiently through an exchange. Are there any carryover lessons that people should be looking for?
Well, I think exchanges can fit with a particular employer's culture and what approach they want to take. So, and some are more flexible than others. So if an employer is really into wellness benefits and things like that, there are some exchanges that make that part of the feature of benefits options. And you can add that to your employee choice menu. Some employers that really want to try and make a difference in the healthcare system in terms of trying to reduce overall costs, may be more excited about looking at an exchange that offers a variety of health plan options, like a tiered or select network, in addition to a full traditional kind of PPO thing. And that gives the employee an option to potentially save some money by going into a different model of product, but without being forced to do that. It is always ultimately their choice. And so it kind of depends on what that employer's philosophy is of what they care about for their employees and what they want to help facilitate in terms of those array of choices.
Rosemarie, as with your experience in the public sector, as you see private exchange adoption continue to grow, and we actually echo what you said about the middle market. We think the middle market is going to be the fastest growing market. What impact do you think private exchange adoption, as it increases, may have on policy decisions in the future?
Well, I think what's fun for me to see about the private exchanges is that a lot of the firms, the tech firms that are, whether it's a technology-led exchange or it's the tech platform that's supporting, even a single carrier exchange, they're able to do some really creative things. They do a lot of consumer research and testing of what makes this, if possible, even fun for the consumer, but certainly simple for the consumer. And they're able to do, frankly, I think more of that often than the public sector is able to. So they continue to lead the way with, incorporating new and improved technology and consumer choice information, which then I think the public sector can, benefit from and potentially adopt down the line. But I see that. So that's not even really a policy thing. It's just the great evolution of technology and innovation in this space.
Yep. If I'm an employer out there, one of the toughest challenges and a big need is that to seek objectivity, because it's very important, but it's also somewhat difficult to come by. What do you see happening to evolve and change that?
Well, I think, it's important for employers to ask that question, and for, I think, the best brokers and benefits consultants are going to say, I understand that you might need to get a second opinion, and be aware of the firms that are out there that are offering that second opinion without feeling threatened that they're being disintermediated, or cut out of the business, if you will. I think they should really keep the employer's overall best interests in mind.
Yeah. So when you're working with an employer and they're beginning to take that first step to navigate this space, what do you suggest those first couple steps be?
So we like to first make sure that there's kind of a level playing field of information and knowledge within the C-suite, or certainly the decision makers within the firm. And so taking it beyond the HR folks, but making sure that the CFO and some other key leaders understand what really a private exchange is. Oftentimes we'll see that somebody went to a conference and came back with some inkling of what they are and has some materials, but it's important, I think, to level set. And so we like to do kind of a workshop or education session to bring more people up to speed on just, what the opportunities are and aren't. And then you start to tailor it if the employer says, okay, that still sounds interesting, across functions here, let's pursue. Then you can start to tailor it and say, now, what are your goals? What have you already tried, and who's out there that might, be kind of a subset of this Wild West marketplace that we can help point you in the direction of. And ultimately, we always recommend doing, an RFP, even some sort of selection process to really vet them.
Would you agree, Rosemarie, that an exchange is not necessarily a strategy? It's a tool that helps execute the strategy. Would you agree with that?
Yes, on one level. No, on another one. And I sometimes think more globally about our health, our healthcare system as a whole. I do see exchange and putting more choice to the consumer, to the demand side, more informed choice as a lever on the whole system, both pressuring against insurers and providers to come up with better, more cost-effective solutions. So that's a tool that supports a strategy, I guess, but some people would call that even a strategy in terms of trying to bend that cost curve. For an individual employer, though, generally I would say I want to see their strategy for employee health and well-being, and then I would consider an exchange a tool to that end.
Yeah. So what final question and what are your takeaways as we close this out? I cannot let you get off the phone in an election year without the scenario that let's say the ACA is repealed. What large changes would you anticipate or not?
So you mean on the private exchange side or just overall?
Yeah, overall, but then the impact particularly on maybe the private exchange part, since we're talking about that. So.
Yeah, I think one of the worst things that would be a consequence of repealing the ACA is that folks with pre-existing conditions would no longer have the protections that they're now enjoying. So you go back into the situation of being locked into a job with a particular health insurance plan because you can't go out on the open market on your own. So I think that would be fairly devastating for a lot of people. But aside from that, the notion of exchanges and whether private exchanges will keep on going even if there aren't public ones, I think that they absolutely will, because there's just, when you look at the trend with millennials and overall consumerism, that is just here to stay regardless of what's happening in Washington, D.C.
Yeah, that train that used the phrase has left the station. Agree?
Yes, I would say so. Yeah.
Well, Rosemarie, this has been great having you on the program, and good to catch up with you again and get your expert perspectives. Leave our audience with a few takeaways, if you would, please, and let them know how they can get in touch with you.
All right. I would say that if you're an employer, a private exchange strategy is one that is worth looking at, particularly because of these trends of consumerism and the employee base as it shifts. The way people expect to get benefits and information is really going to be much more modular, and so an exchange can be a key part of that strategy. It's worth a look. In terms of getting in touch with us, we're online www.dayhealthstrategies.com. We have contact info right there. You can email me anytime, Rosemarie@dayhealthstrategies.com, and happy to answer questions.
Thanks, Rosemarie. You have a great weekend, and we'll talk to you again real soon.
All right. Thanks. Take care.